Hi, I'm Julie. On this occasion I will talk about warning signs of diabetes. Hope you enjoy it. 6 early warning signs of diabetes you should not ignore. Diabetes mellitus, commonly known as diabetes, is a metabolic disease characterized by high levels of sugar, glucose, in the blood. As of 2014, about 387 million people worldwide suffered from diabetes. Diabetes occurs when the pancreas is either not producing enough insulin or the cells are not able to respond properly to the insulin produced. Diabetes is often called a silent killer because of its easy-to-miss symptoms. Most often, people do not even know that they have diabetes, as early symptoms sometimes seem harmless. Early diagnosis and treatment can help prevent serious complications, which include cardiovascular disease, nerve damage, kidney damage, eye damage, foot damage, skin problems and pregnancy complications. Here are the top 6 early warning signs of diabetes you should not ignore. 1. Frequent and/or excessive urination. One of the earliest signs of both type 1 and type 2 diabetes is frequent urination with an abnormally large amount of urine. In medical terms, this classic sign is known as polyuria. When you have diabetes, excess sugar, glucose, builds up in your blood. The kidneys have to work really hard to filter and absorb all that extra glucose. During this time, the excess glucose gets excreted into the urine, soaking up fluids drawn from your tissues. This leads to abnormally high urine output. A persistent need to urinate, especially if you have to get up at night to use the bathroom, is something that you need to take seriously and consult your doctor immediately. 2. Feeling more thirsty. Extreme thirst is one of the first noticeable symptoms of diabetes. Due to frequent urination, the body becomes dehydrated, making you feel very thirsty. If you drink sugary beverages like juice, soda or chocolate milk to quench this thirst, more sugar enters the body, leading to more thirst. If the reason behind frequent thirst is high blood sugar levels, drinking will not satisfy the thirst. This is not the case when the problem is due to allergies, the flu, the common cold, fever or dehydration caused by vomiting or diarrhea. If you are feeling abnormally thirsty and drinking water doesn't satisfy your thirst, consult your doctor. 3. Hunger pangs. Having frequent hunger pangs is another sign of diabetes. When people suffer from diabetes, they feel more hungry than usual and tend to eat more. This happens because the body cannot regulate glucose that your cells use for energy. When the cells are deprived of glucose, your body automatically looks for more sources of fuel, causing persistent hunger. In addition, eating more will not get rid of the feeling of hunger in people with undiagnosed or uncontrolled diabetes, as this will just further elevate the blood sugar level. So, eating more will only exacerbate the problem. Speak with your doctor if your excessive hunger continues for a prolonged length of time. An increase in hunger can also be the result of other issues, such as depression or stress, that may require treatment. 4. Slow wound healing. Cuts and scrapes heal slowly in a diabetic person as compared to a person who does not have this condition. High blood sugar hardens the arteries, making the blood vessels narrower than usual. This causes less blood flow and oxygen to a wounded area, hence taking more time for the wound to heal. In addition, elevated blood sugar has a direct impact on the functions of red blood cells that carry nutrients to the tissues. This also slows the healing of wounds. Apart from slow healing, the wound can develop into an ulcer or become infected. Hence, wounds, no matter how small, require close monitoring. Make sure to consult your doctor soon if your wound becomes infected or doesn't heal. 5. Recurring infections. High blood sugar makes people highly susceptible to different types of infections. The most common sites of infection in diabetic patients are the skin and urinary tract. Diabetics suffer from frequent infections, and sometimes the infection recurs. This mainly happens due to a weakened immune system. A 2012 study published in the Indian Journal of Endocrinology and Metabolism reports that infectious diseases are more prevalent in people with diabetes. According to the study, a hyperglycemic environment increases the virulence of some pathogens, thus causing infections. If you keep getting infections, it is important to get checked for diabetes. A simple blood test is enough to know your health status. 6. Unexplained weight loss. While obesity is a risk factor for diabetes, shedding pounds without even trying is a sign of the disease. Weight loss in such cases happens mainly for two reasons: excess water loss in the body due to frequent urination, and the body is not able to absorb calories from the sugar in the blood. In addition, insufficient insulin compels the body to break down protein from the muscles as an alternate source of fuel, causing a drop in body weight. In both type 1 and type 2 diabetes, one of the earliest signs is fairly dramatic weight loss. Rapid, unexplained weight loss is not healthy and requires further investigation. Hence, make sure to consult your doctor.